So basically what we showed was that the annualized attack rate decreased year by year, ultimately resulting in a very low attack frequency in those individuals with further exposure. And I think one of the things that was very interesting to me to see here was that when you look at what we call the hazard ratio, which compares the risk of attack between those who are actively treated with those who aren't treated, that hazard ratio, which we typically assume to always be the same, comparing a drug to no treatment, actually changed over time, so that the drug seems to, with repeated exposure, become more and more effective over time. And I think that's a very interesting observation because it speaks to a biological impact of long-term B-cell depletion in NMO and resonates, I think, with the clinical experience that many of us have had when we have treated patients with other B-cell depleting therapies such as rituximab, that once patients stabilize on treatment, they tend to stay stable on treatment over the long term. And the data from this study helps substantiate and support that. Equally important to the efficacy results are the safety results, and overall, there were no new safety signals seen with 4 years of ongoing treatment. The main issue from my point of view having to do with patient safety over long term with this product is hypogammaglobulinemia, which can be acquired. It doesn't happen to all patients, but it does happen to some, and there will be considerations that have to be given with respect to acquired hypogammaglobulinemia for our patients, because those individuals are going to be at increased risk of infection. And so this raises a question about, well, when a patient does become hypogammaglobulinemic, does one supplement with IVIG, which is one possibility, or would one consider having to switch therapies, which would be another possibility? So those are, from my point of view, the main safety issues that have to be considered. It also means that I think it's a good idea to monitor the IgG periodically in inebilizumab-treated patients. In my personal practice, I do this once a year. Other people like to do it at every infusion. I'm not sure that that needs to be done. But nonetheless, I think monitoring the IgG, however one feels most comfortable, is an important feature of treating patients over the long term with inebilizumab.